Hello, and welcome to Everyday Creation, the show about living our purpose, lifting our vibes, and expressing our creativity for the highest good. This is Kate Jones with the fourth excerpt from a longer interview with family medicine physician Adeola Fakolade, MD. In this episode, Adeola talks about having access to care and maximizing our medical appointments. Well, please talk about the importance of helping patients have access to primary care. I know you're really passionate about this.
Yeah, yes. I believe that primary care is the bedrock of any high functioning healthcare system. If you want better health outcomes for your population, then you should be investing in high quality primary care. For some of the reasons I've already mentioned, a primary care physician or a primary care provider, because it's not just physicians that provide primary care in the United States, it's different players. But a primary care provider really should be, from a patient perspective, really should be like your quote unquote partner, quote unquote guardian to help you kind of navigate the healthcare system. Your primary care provider is like your partner in your health. Your primary care provider should be your champion for you just staying healthy. I cannot overemphasize the importance of primary care. And obviously, I'm a primary care physician, so I might be a little biased, but I think it's also true.
That's why you went into it. You
But
went into that part of medicine because you saw the importance of it.
right, right. And for a while there, actually, when I was in medical school, I thought I was going to go into oncology. Because I think I told you from my last conversation, my dad passed away from cancer, stomach cancer. And one of the contributing factors, I think, because again, we cannot go back and undo things and get like the exact causes as to what happened or what didn't happen. But I think one of the things that certainly didn't make anything better was the fact that he had like a misdiagnosis. Like he kept going to different, doctors, going to the hospital, and he just couldn't catch it on time. And by the time they found out, like it was too late. And so for the longest time, I thought, yeah, oncology, oncology, oncology. That's what I was going to do. But it didn't really sit right with me. It just felt like that sort of like medicine after death, so to speak. And so in a roundabout way, I ended up in primary care, which is on the prevention side. So I'm really passionate about cancer prevention as well. So like I will talk to my patients until I'm blue in the face about getting the vaccines that can prevent cancer, about getting, like smoking, like quit smoking, etc. If they're using like they're drinking a lot of alcohol, like I talk and talk and talk until I'm blue in the face. So yes, so that's sort of a roundabout way as to how I ended up in primary care. So
You said something to me when we spoke last time that even when patients have access to primary care, they don't really maximize their time with their physician. So please talk about that. What advice do you give them?
oh boy. I think we may have unleashed the floodgates here, but I'm trying to keep it concise. And part of this, the way the healthcare system is set up in the US, most primary care offices, they have what, 15 minutes, if you're lucky, 20 minutes. That's the appointment slots they have for each patient. And that is just built on the fee for service model as opposed to, like the outcomes model. So, because it's like, okay, just get the patient in, you need to fulfill their prescriptions, done. Next patient, et cetera, and all of that. And so I think it's important for patients to understand that because I think it can help them sort of maximize their primary care visits. The first thing I'd say is show up on time for your appointments. Don't be late. Because again, out of that 15 or 20 minutes, the medical assistant is going to room you, going to take your blood pressure, going to find out like why are you here today, etc., and all of that. So if you show up late, you're already kind of cutting into your time. And if your doctor is already running behind, you just don't have as much time to talk about your concerns. And your doctor is sort of worried about running behind as well and trying to get to the next patient, etc. So in a way your visit can be a little rushed and you don't want that. You might be waiting like 2 months for this appointment and then to get there and then it's like, well, that was kind of a waste of my time, or you leave your appointment feeling dissatisfied with the outcome. Nobody wants that. So show up on time, show up before your appointment time if you can, show up on time for your visits. And then the other thing I'd say is be very organized. Okay. Know what you want. What are your goals for this visit? What is important to you? You're going to see your doctor today. What is it that you just absolutely have to get addressed at this visit, and lay that out right from the beginning. Okay. Tell your doctor, hey, this and this and this and this is what I want to discuss today. And bear in mind that your doctor probably has some things that they want to talk about with you as well. Depending on, if you had labs completed, something is going wrong, or, we got to talk about diabetes, etc., and all of that. But just lay it all out up front so that you and your doctor can come up with a plan like, okay, if we can't address it all today, maybe we can pick the top three things. Like, this has to be done today. So just be upfront. Don't spend your time talking about something that is not as relevant, and then 20 minutes into the visit, you're like, oh, by the way, this is something else that I want to talk about. I think it leaves everybody kind of feeling a little dissatisfied. So be very, very organized. And one thing that I've noticed too, I think a lot of patients often don't understand the different types of visits. As a general rule, I'd say there's three kinds of visits in primary care. There's your annual wellness exam or physical. That's where you go in, you talk to your doctor, they're talking to you about, like diet, exercise, colonoscopies, smoking, immunization, etc., just like a wellness check. And then just making sure that your chronic conditions are stable and they're well controlled. That kind of visit doesn't really include bringing up new problems. Okay, this is just for the physical. They're going over your medical history, your family history, going over your health behaviors, etc., and all of that. And then there is just like a follow-up appointment, which is just, oh, I'm just coming in to follow up on my blood pressure or diabetes or depression, just to kind of make sure everything is okay. We can adjust medications if we need to, etc. And then the third type would be like an acute visit where if you woke up in the morning and you're like, oh, I don't feel good today. Or, I sprained my ankle yesterday. You call like your doctor's office and they're like, oh yeah, sure, we can fit you in. And then we're just addressing that specific thing. So in my experience, I found that a lot of patients don't even understand that difference, essentially. I was going to say dichotomy, but there's three different types of visits. They don't understand that difference between the types of visits. And so I think understanding those kind of visits can help you as a patient also show up prepared for your appointment. Now, that being said, oftentimes, because again, there's just not enough primary care doctors, many doctors may offer to maybe combine, like your physical exam with something else. So during that visit, even though they're technically not supposed to, be addressing any new problems, but you're there in front of them. Okay, let's talk about it. Let's figure it out. Let's get you taken care of. So oftentimes these visits are combined. Just something for you to kind of keep in mind as patients. The other thing I would say, and these are just general things, is find a primary care provider that respects you. Because I think that a primary care provider that respects you will listen to you. A primary care provider that listens to you can actually help you. So if you get connected with a primary care provider and it just feels like things are not working out, like it's okay. It's okay. Sometimes some things just don't work out, sometimes personalities, etc. It's okay. But because of how important primary care it is very important to find a primary care provider that you connect with, somebody that listens to you, somebody that respects you. Okay. So keep that in mind. It might take a few tries to find somebody that is a good fit, but keep going because I think it's worth it to find like a primary care doctor or provider that you just absolutely love. I think it's very important just because of the importance of primary care. Other tips that I would say is be kind, be human. Okay. Don't show up to your appointment and then be rude to the front desk staff or be rude to, the nurse or be rude to the janitors. Just don't be that person. Nobody likes that person. Just don't be.
I think that's good general advice
Yeah.
wherever you go.
Yes. Just don't be that person. And in general too, I would say as well, if your PCP wants you to do a test or says, make this change, like do what your PCP asks you to do. If your PCP says, oh, we're going to make that change or, use this medication, etc., use it. And or if you don't want to use it, have an honest conversation with your PCP about like this is why like you'd rather not use it so that they can come up with an alternative for you. And again, I think that goes back to finding like a PCP that you're compatible with or is compatible with you and someone that will listen to you. Because I think it's sort of pointless if you have a PCP that you don't respect. That's the other part of it. Find a PCP that you respect as well. When you're not doing what you're supposed to do, we're chasing our tail. Like we're use this medication, use the medication, and then you come back and well, you're not better. well, yeah, there's a reason why you're not better because you haven't using the medication. So, but it can be very, very frustrating and counterproductive. So find a PCP you respect and do what your PCP tells you to do. Find a PCP that you trust as well. I guess that's also the key element. You got to trust your PCP. So, so I think I'll stop there for now because if you let me go, I will keep going. So, yeah.
Well, it sounds like you're speaking from experience. I know you have confidentiality that you have to really abide by, but in general terms, have you felt that frustration sometimes?
Yes, I have. It's just sometimes it's not that bad. I think maybe the reason that I'm talking about is like today I had kind of a situation like that. I'd prescribed the medication, I'd ordered some blood work, and I saw the results of it. I was like, something is not right here. So I asked my staff to reach out to the patient, like, hey, what's going on? Are you using this medication? And then the message came back, oh, the patient is using the medication minimally. I'm like, okay, what does that mean? Why? So that's a conversation I'm going to have at the next appointment.
Creative, don't you think, Emily? The patient is a minimalist.
Yeah. Yeah. Well, I understand that, but then the problem is not really going away. So we have to find a solution. So that's a conversation that I'm going to be having soon.
That's great. Well, is there anything else about primary care that you'd like to talk about?
What I'd say too is, again, because of the shortage of primary care in general, oftentimes, and especially if your primary care provider is not in private practice, oftentimes your provider is going to work with other providers. So they work in a group. And so if you call your doctor or you call your provider and something is going on, you need an acute visit and they can't fit you in, be willing to see some of the other doctors in the practice because we just want to make sure that you can get the care that you need when you need it because that's also something about primary care that is very important. You need to be able to access the care when you need it. So be willing to see other providers in the practice as well. But primary care is very, very important. I cannot overemphasize the importance of it. That's where you're going to get your screenings. A lot of work that has been done in cancer prevention, the survival rates of breast cancer, etc., and all of that is at the screening level. That's all done at the primary care level. When your doctor says, hey, you need to get your mammogram, it's important. There's a reason why they're saying it. And if your doctor is saying, hey, you need to get your colonoscopy, it's important. There's a reason why they're saying here because we have a lot of data that shows that these save lives. So listen to your PCP. Again, find somebody that you can trust, find somebody that you respect, somebody that listens to you. So
This is Kate again. If you want to hear more from Adeola, you'll find the other episodes listed in the show's description. Thank you for listening to Everyday Creation, and please share as you wish.